Joining us now to discuss more is the Executive Medical Director of Infectious Disease and Prevention at Advocate Aurora Health, Dr. Robert Citrenberg. Good morning. Thanks for being with us.
Good morning.
So talk about this ineffectiveness they're saying of this fourth vaccine. People wonder if we're going to keep getting boosters, or are these going to be pointless after a while? Is there any scientific validity to them the more we get?
Well, I think it really depends on how you look at it. There's no doubt that the vaccine, including the booster, does not prevent acquiring Omicron or spreading it. But what it does do, and very effectively, it prevents you from getting very sick, getting hospitalized, or dying. So I think this is one of the reasons why we have to stop looking at the numbers of cases in total and just really focus on hospitalizations and deaths. So it's challenging to continue to develop new vaccines for each variant, but there's no doubt that if you are fully vaccinated and boosted and not immunocompromised, and you get Omicron, which you may well get, your chances of being hospitalized or dying from it remain remote. In fact, the risk of death in unvaccinated patients in Illinois is 22 times higher if you're unvaccinated compared to if you're vaccinated. So there's still a tremendous value to getting vaccinated and boosted, even if the booster doesn't completely prevent transmission of Omicron.
And for these reasons, I think people feel like Omicron is going to be what gets us to the other side, and after, whatever, March, maybe this will be over. Can we assume that future variants would be weaker, or is that not necessarily the case? Could they possibly come back stronger?
In general, as viruses mutate a lot, they become what we call less virulent or weaker. But it's really, this virus has proved to be very tricky and has not really followed all the rules. So there will be more variants that circulate. Really, the key, though, for our success in our society is to convert this pandemic to an endemic form where it's just around, but it's not affecting a lot of people at one time. And so Omicron itself won't do that, but Omicron in combination with people getting vaccinated and boosted will. So that's really the key. And no matter how many people get Omicron, the immunity probably is fairly short-lived. You need that in combination with vaccine immunity in order to convert the pandemic phase into the endemic phase, which is something that we can live with quite easily.
Yeah, now people are wondering about that. We heard the Pfizer CEO come out and say he thinks return to normal life is going to happen soon as this spring, and Omicron might be the last wave with restrictions. Is that because of these COVID drugs that are coming out on the horizon? What do you think about what he said?
I think it's a combination of things. One, the number of people who've been recently infected, the number of people who get vaccinated. We're trying to continue to improve those numbers. And also, there's going to be seasonal changes too. Remember, the coronaviruses typically are wintertime viruses. They're transmitted more efficiently in colder and drier air. So you get into warmer, more humid weather. They don't transmit as efficiently. So it may be lining up well. We can get through this Omicron phase. We can get more people vaccinated. Then we have seasonal changes. We would anticipate, barring some unexpected circumstance, that into the summer and the fall, things will be much better. The therapeutics you discussed absolutely have a role, particularly the drug Paxlovid, which is one that's very effective in preventing people from getting in the hospital. So all of those things together do look for a pretty bright spring and summer, but we still have to get people vaccinated.
All right, Dr. Citrenberg, we appreciate you joining us. Thank you, sir.
Thanks for being with us. On to other news.